Good morning, everyone. It's 8:31, and so I think we will go ahead and get started. I'm Peter Slavin, president of the hospital, and it's a great pleasure for me to welcome you to this inaugural symposium sponsored by the MGH Center for the Environment and Health. Um, this symposium is entitled "Climate Change: Our Healthcare System, Our Patients, and You." And I understand that we have hundreds of people who have joined us this morning, which I think is terrific because this is obviously such a critical issue to our hospital community and the world. The potential impact of climate change, which we've already seen to a significant degree, is overwhelming and is a huge potential health threat to the people of this region and people more broadly around the world. And so there was a group of individuals, a cross section of people across this organization, including some who planned this symposium and are now leading the center, who came together and I think made a very convincing case that we as an institution should really take a leadership role in trying to do something proactively to address environmental issues that intersect so profoundly with health. And so thanks to them, we now have a center for the environment and health at Mass General that is really trying to address the environment as in all of its aspects with respect to our missions: clinical care, research, education, as well as advocacy. Clearly, the work of this group will influence the buildings that we build, the way that we handle waste, the research agenda that we take on, what we educate our trainees and staff in, and the advocacy positions we take locally and nationally as well. So I want to thank Jonathan Slutzman and the director of the center and his colleagues for the work they did to make the case that we should really launch an initiative in this important area. So I think one of the first acts of this center has been to organize this symposium to really bring a broad-based group of people from across our community together to learn more about these issues and figure out ways to help broadly across the organization have an impact. And so I want to welcome you to that inaugural symposium. We are thrilled to have a terrific keynote speaker, Dr. Renee Salas, who comes from within our own midst. Renee is really emerged as a leading expert in our country, really at the nexus of climate change, health, and healthcare. She served as the lead author of the Lancet Countdown on Health and Climate Change, U.S. Brief since 2018, and founded and leads its working group of over 70 U.S. organizations, institutions, and centers. She was a co-director of the first Climate Crisis and Clinical Practice Symposium in partnership with the New England Journal of Medicine and spearheads that broader initiative. And she also serves on the planning committee for the National Academy of Medicine's Climate Change and Human Health Grand Challenge. Her work has appeared broadly in the media, in places like the New York Times, NPR, Time, and the Associated Press. And when she's not trying to save the world from climate change, she is a faculty member within our emergency department, where she is an assistant professor at Harvard Medical School as well. So, Renee, I want to thank you for agreeing to give the inaugural lecture at this symposium, and it's my pleasure to turn the floor over to you. Thank you all so much for joining us.
Well, thank you so much, Dr. Slavin. This is such a momentous occasion, and it is such an honor to be here. The center has launched, and I hope over the next half an hour that I spend with you that I can help you see why it is so important and vital and actually interconnected with everything that you do. So I'm going to start out with 3 stories that may initially not seem to be related. The first was an elderly patient whose wife called 911 because he was acting confused. And the EMS crew said that when they got there, they climbed up multiple flights of stairs to reach the top level. And that when they opened the door, they felt like they were being struck with heat from the Sahara Desert. Now, this couple did not have air conditioning and only had one window, which was partially cracked on, unfortunately, more record-breaking heat within Boston. So they brought him to our emergency department here at MGH, and we rapidly got a rectal temperature, and his core temperature was 106 degrees Fahrenheit. So he was suffering from heat stroke, yet his triage diagnosis had been fever. There was another patient, a young 4-year-old girl who presented for her third visit that week for yet another asthma exacerbation. Her mother was overwhelmed with how to help protect her daughter from the enormously high pollen levels that her daughter had been suffering and from the particulate air pollution that her address exposed her to. And then the last one is a woman who showed up from Boston Logan Airport. She came directly from Puerto Rico in the months following Hurricane Maria. And I will never forget it. She thrust this bag of empty medication bottles at me that had not been filled for months. And she showed up in my emergency department with nowhere to go and needing refills and connection to the healthcare system. Now, all of those can seem like they're different stories. Yet there's one theme that runs throughout it, and that is the fact that climate change, either directly or indirectly, is harming their health or leading to situations that is worsening their ability to access healthcare. Climate change is often described as what I call a meta problem, meaning that it is a problem that underlies so many of the other major health crises facing us at this moment. But it's also a threat multiplier, meaning that it makes those problems worse. And thus it touches everything. And I hope that through this talk, you can find ways that it is already touching your clinical practice and your ability to deliver high quality healthcare. And together we can step forward on a path to figure out what we need to do to go forward. So 3 key messages for this time together, and that's that climate change, air pollution, and healthcare are intertwined in a vicious cycle. And climate change threatens the very mission of us as health professionals and for our healthcare system, making it harder for us to do our job. And so we have to simultaneously act on multiple levers due to the urgency of this issue, and you have a role to play. So what is this vicious cycle? So oftentimes you may have been reading the headlines about the launch of the new center and see the term greenhouse gases, and it may feel really far removed from what you do every day. Healthcare is contributing upwards of 10% by some estimates of greenhouse gas emissions in the United States that is fueling climate change. Yet there's also this intimate connection with air pollution because the combustion of fossil fuels also produces particulate air pollution. And all of this is thus making it harder for us. It's harming our patients, often inequitably. It's threatening our ability to deliver optimal clinical practice, and it's disrupting our healthcare delivery. So we have to stop this vicious cycle. And that's why I'm so inspired by the launch of this center that is really seeking to get to the root of this problem. Because reality is that there is urgency in this. So we are currently at approximately 1.2 degrees Celsius today, average global temperatures above the pre-industrial averages. You often hear about the Paris Agreement, and that talks about trying to keep temperatures well below 2 degrees Celsius by 2100. That's not very far away, and our children today will be alive, hopefully, in 2100. Yet we really want to try to keep temperatures well below, so to 1.5 degrees Celsius. And that does not give us much leeway from where we are now at, again, upwards about 1.2. And as you see with the current policy projections, right now by 2100, even with current commitments, we are upwards originally of about 4 degrees Celsius. Now, this is data from December of 2020. And if you've been following the news, you've seen that there were some really ambitious announcements and commitments from the Biden-Harris administration, which is phenomenal. And it's moving us in the right direction. But as you see with this, that the gap we need in order to truly keep us to 1.5 degrees Celsius, that this has actually only narrowed that gap by about 12 to 14%. Now, this is a global problem, and we all need to work on this together, but we still have a ways to go. And the reality is that even at 1.5 degrees Celsius, that doesn't seem like very much, especially for us in our Fahrenheit world. But if you look, this is what the change in that average temperature means for the mean temperature at both the 25th percentile and the 75th percentile. Now, this dark red color means extreme heat, and you'll see that there are certain aspects of the world that will be experiencing upwards of 9 degrees Celsius change, even with just a 1.5 degrees Celsius warmer world. And this again brings out another theme that climate change is not an equal opportunity harmer, and there are individuals who are disproportionately exposed. So as these greenhouse gases that we have produced are warming our planet, it creates a series of climate drivers, increasing temperatures, intensification of extreme weather events, and rising sea levels, which are especially important consideration for us on the coast. And as I mentioned before, air pollution, we know contributes to significant comorbidities, as you see here in this figure. And we can have immediate near-term health benefits by moving away from the combustion of fossil fuel. Again, that same root cause. And as we've seen, the horizons can clear during the pandemic. And so we can see this on the near term, not in addition to preparing for a future of decreased greenhouse gas emissions and improving our chances at decreased suffering from climate change. So independent of wherever you are and whatever your role is within the MGH system, I would argue that there is a way that climate change is touching your practice. So these exposure pathways include extreme heat, air quality implications, which is not only particulate air pollution, but also wildfire smoke, ground level ozone, and higher pollen levels. It has food and water implications, both on our quality and quantity. As I mentioned, it's intensifying our extreme weather. It's also having significant implications for vector-borne and some waterborne diseases. And it creates these social implications, such as internal displacement, like my patient who was displaced following Hurricane Maria. Climate refugees is not something that is only across the ocean. It is occurring here today. And so I encourage you, there's an interactive perspective on the climate crisis and health page at the New England Journal of Medicine. And if you love to sort of interact online, you can actually click and interact into this giant matrix of interconnected issues through your specialty. So whatever your typical patients are that you see, because we know that, for example, heat is having implications for negative pregnancy outcomes. So it affects the obstetric and gynecology colleagues in our hospital. It also affects age differentials differently. So pediatrics and older persons are also disproportionately harmed. So it is important to think through and start to think about, as you see patients, how is it that climate change is harming my patients? Because the reality is that it's not harming them equally. And you'll hear more about this later this morning in regards to the inequitable distribution of health harms and how environmental racism, which is a subtype of systemic racism, is already contributing to significant health disparities to individuals across our country. And climate change is, as I mentioned before, a threat multiplier and worsening those health outcomes. So what do we do? Any photographers out there? I always think about it as adding a climate lens, which all that means is looking and trying to understand how is climate change impacting this issue now? And how is it going to impact this in the future? Because we know these different exposure pathways vary based off the geographic region that we're in. We're going to experience it differently based off our specialty and role within the healthcare system. And it's going to vary based off the local healthcare infrastructure, not only our own institution, but how institutions work together and how patients flow between one system and another. So hopefully you can look at this map and identify somewhere that you tend to spend most of your time. So climate change is having significant implications for public health. So as we add that climate lens, we can start thinking about how can we begin to prevent this root problem at the very core. For example, we often subsidize heat for individuals during winter. Should we start subsidizing cooling for individuals who do not have the ability to either own an air conditioner or pay the significant electricity bills associated with it? We think about our pre-hospital colleagues. They're going into the homes of our patients. And it's been phenomenal to watch my emergency department colleagues really use a pre-hospital system and to actually send individuals out to patients' homes. Now, as these individuals are within these homes, we can think about how can they identify potential climate threats and begin to address them and educate patients on what those are. For those of us that work in the clinical practice realm, again, we think about how we need to think through our triage diagnosis in the emergency department. As I think about that patient who was labeled as a fever, but turned out to be heat stroke. In fact, it's oftentimes we think about heat as this universal exposure across the US, but the temperatures at which the peak hospitalizations occur actually vary substantially across different regions. In the Northeast, it's actually 86 degrees Fahrenheit when peak hospitalizations for heat-related illness begins. Much lower, I think, than many of us would have predicted. But what if we had a flag on our electronic health record system that notified triage nurses anytime a fever was placed in as a diagnosis on a day when we had temperatures that were capable of causing heat-related illness? Because they could then ask the follow-up question of, was that individual exposed to extreme heat? Now, if my patient had been sitting in an air-conditioned apartment, then it wouldn't have been heat stroke. And the patient probably had a urinary tract infection and urosepsis. But in this case, it wasn't. So we have to think about how can we also screen our patients that we can determine who are most at risk. Thinking about the diagnosis with the evolving distribution geographically and temporally for vector-borne illnesses. Now, every rash in my emergency department has to think about Lyme disease. And I would argue your primary care office as well. Certain treatments that we give our patients actually make them more at risk for certain heat-related illnesses. How can we think about that risk-benefit ratio in a different way about whether certain patients maybe truly are at higher risk and thus maybe shouldn't be placed on certain medications? These can include antihypertensives, psychiatric medications, and others. And then thinking through how we can really empower our patients. We have to recognize that they oftentimes don't see the connections between climate change and their health. But as we make these connections for them, we can empower them with ways in which to help minimize their exposure and help protect not only themselves, but their family and loved ones. So all of this is a critical thing to think through, but we also have to recognize that as a clinician, I practice best when I am in infrastructure that is at full capacity with power and the supplies that I need. So as we think about infrastructure, this is probably the one where the intensification of extreme weather tends to be something we understand because we've seen it in the headlines or we've experienced it ourselves. And so this is an example from Hurricane Michael, and just highlighting that even in our modern day and age, our disaster colleagues have known how to handle these disaster events, but we're all facing an unprecedented future. And so this hospital actually had to send a tweet in order to try to get supplies delivered through a roadblock. This is an example actually from our colleagues just down the street. This was on an approximately 90-degree Fahrenheit day, and the hospital suffered a power outage. Now, oftentimes power outages do not thus provide electricity and power to the cooling of hospitals. Now, this hospital, actually, the temperatures got so warm in certain areas and the upper floors that firefighters had to evacuate the patients down to lower levels in order to keep the patients safe. And certain diagnostic equipment became so overheated that even after power was restored, it still took a few hours for it to cool down sufficiently to be active and work. Now, we know that power outages are going to become, and already have become, more frequent as a result of extreme heat, for example, as that puts increased demands on the infrastructure. And the intensification of extreme weather is also contributing. So we are going to be facing more power outages in our future in healthcare. And we need supplies. Now, many of you, I think, experienced the the shortage of intravenous saline. There's a factory that was on Puerto Rico that produced over half of intravenous saline products. Now, when that was damaged, that led to widespread shortages that affected even me in the emergency department. And if patients didn't meet certain criteria, we would hand them a can of Gatorade instead of intravenous fluids. Now, if this is already happening with water in a bag, essentially, where are other vulnerabilities within the supply chain? And we've additionally seen these vulnerabilities in the COVID-19 pandemic around PPE and ventilators. So the reality is that more is sort of unknown than known. And so I recognize the irony of the picture of an iceberg that we see was just above the surface. But I'm worried about what's underneath. And so, for example, heat, which is really our best understood exposure pathway, has been linked to rising microbial resistance to antibiotics, or when mothers are exposed to extreme heat, possible linkages to the development of congenital heart defects in their infants. Now, all of this requires more work, but we have to recognize that this threat multiplier phenomenon has its fingerprints everywhere. So as we face this unprecedented future, we can't look in the rearview mirror. I don't know about you, but I love to look at an old urine culture to figure out what antibiotics to give my patient. So we need an evidence-based path forward so we can understand that. And that requires multidisciplinary collaboration, not only within our hospital, but abroad and with other specialties and sectors like climate scientists and social and behavioral scientists. And that is why this center is exciting, because it's bringing the hospital together around this topic. Because reality is that as we think about how all of this is interacting, whether it's systemic racism and climate change with the pandemic, which has added a whole different layer, we can actually have an enormous opportunity for interconnected solutions that can allow us to rise above these challenges together and at the same time. And I look forward to discussing these further throughout the morning. There's a story that I heard a while back when I was getting my public health training, and I think it really resonates here. And that's the recognition that we're all standing beside a stream. So imagine two health professionals standing at this stream side. Beautiful, right? And patients suddenly become floating down the river. So we begin pulling these patients out of the river one at a time, working together side by side. But suddenly, one of the health professionals starts to walk upstream. The one left behind, suddenly overwhelmed at thinking they have to pull these patients out by themselves, shouts out to the other one and says, where are you going? And they look back and they say, I'm going to head upstream and figure out determine whatever is throwing these patients in the river to begin with and stop it there. And that's really what we all have to do with this. We all are standing at different parts of the stream, and some of us are standing downstream and running upstream, and some of us will be just at one place. But together we can cover that full stream. So the ways in which we can tackle this problem involves getting to the root core, which is, again, what this center is based on, of getting to mitigation and ensuring that our healthcare system is not contributing to climate change, to the production of greenhouse gases. We often term that as sustainability. Sequestration, again, this is an all hands on deck, because when I showed you that thermometer, what I didn't tell you was that we only have about a decade, so until 2030, to try to cut our emissions globally in half and then get to net zero by 2050. So the urgency is there. And then as we think about our public health, clinical practice, and healthcare systems, we have to think about how to adapt them, like I talked through with our clinical practice, and how we can make our healthcare systems more resilient to the challenges ahead. Now, I recognize there are these lines here kind of between the areas, but I think actually after my pandemic experience, I removed those because it has been exposed to all of us. The fact that there are no barriers between public health and our healthcare systems, because when the public health system is unable to prevent the harm, we suffer the consequences, and vice versa. So we have to work together in a unified front. So I'm back at this grid because I want you to think through, where is it that you spend most of your time, whether that's in healthcare system leadership and thinking about our delivery and our infrastructure, or is it in clinical practice or in the public health realm or in community paramedicine in the pre-hospital system? And challenge you to find at least one way in which you can start to help contribute to this adaptation and resiliency. We launched something that is called the Climate Crisis in Clinical Practice Symposium, which Dr. Slavin had mentioned. And the goal of that was to bring together all of the healthcare systems within Boston. And we did that in February of 2020. Little did we know that that would be one of the last in-person events. But that really was for us to talk through how climate change is impacting clinical practice across specialties, where the commonalities are, and how is it impacting our healthcare delivery, and what can we do about it? This has led to multiple flagship sites around the US that are doing similar events to bring together their healthcare community. That's occurred in Cleveland and Atlanta, for example, and there's others forthcoming. But this also mandates a larger systemic and comprehensive assessment, which is forthcoming, because we need to begin to understand these in a way that gets the geographic perspectives, gets the different specialty perspectives, and we can really start to see unison and common themes that emerge. So here are some potential ways that you can get involved. And again, there will be more that will be discussed throughout the morning. So thinking about how you can adapt your clinical practice. How can you better screen patients, better educate them? Think a little bit deeper about potential harms around certain medications. Another example, actually, epinephrine and albuterol have been found that when they're left or exposed to extremely high temperatures, they have decreased efficacy. Now, as we think about rising temperatures environmentally, the temperatures within our cars are actually getting substantially hotter as well. And so simple things like reminding your patient not to leave their EpiPens or their albuterol inhalers in cars. Because we think about the healthcare system and ways that we can adapt and build resiliency. And sustainability is that core feature. It is not abstract because it is looking to get to the very root cause that is making our jobs harder. And now with the center, there's ways for you to get involved. In addition, we have brilliant disaster colleagues who have been thinking through this and actually completing assessments to understand what the vulnerabilities for the healthcare system are and will be. So again, not using the rearview mirror, but really trying to understand the future. And they're building these considerations into new buildings and updates to our healthcare infrastructure. We have to think about how to help our public health colleagues and work very closely with them and to help them adapt, to help prevent these issues at the root. We have to think about how to not only educate ourselves as practicing clinicians, but our trainees, our patients, and the public. Now, this is extremely vital as we think about providing a really dynamic, climate-sensitive education to our trainees. We need to also think about how to add a research lens. So there are certain items which are currently being studied, and you have that infrastructure in place. Because of the urgency with which we need to better understand this problem, we can begin adding sub-questions or sub-analyses to your existing research infrastructure to better understand what are the implications of climate change. So for example, rising temperatures, how does that affect what you already study? Because by tapping into the existing infrastructure, we can more quickly get answers while we simultaneously attempt to build the critically needed infrastructure to better understand these problems. And of course, personal changes are critical. And we can think about how we can lead with the way we live our life. But in the end, all of this is not going to be enough to make these systemic changes that we have to implement if we want to have any attempt at keeping global temperatures below 1.5 degrees Celsius. And so advocacy and outreach is essential and fundamental. It's just running upstream in order to stop those patients from being thrown in the river at the very beginning. So in conclusion, I hope you have some understanding of how climate change, air pollution, and healthcare truly are in this vicious cycle. It is time to stop the cycle, and the center is a path to do that. Climate change threatens our very mission. So greenhouse gas production is not abstract, but it is making our jobs harder, inequitably harming our patients, disrupting our healthcare system, and challenging our ability to deliver high quality care and to achieve our mission, which is to improve health and save lives and prevent harm. And we have to act simultaneously. So all of us together that are on this call, if everyone picked one, just even one way with which to engage, we can begin to catalyze even further momentum than is already building. So at the end of the day, I often reflect back on where I started, which is practicing in the emergency department before I felt called to run upstream. But there is nothing that is more encouraging for me than when I stand in a room and watch individuals from across the healthcare system, whether that be environmental services who clean the room, or the radiology technicians who take the chest x-ray so I can get a vision into the lungs of my patient, or the nurse or the pharmacist or the trainees. We all work together to save the life of that patient. And we all step in that room, setting aside our differences with that common goal, because we are bonded together in this. I am seeing the same proverbial trauma room filling with individuals just like yourself. And we will tackle this together. Thank you so much for your time.
Renee, thank you so much for a wonderful talk that has really taken what is a global and societal issue that we're all facing and brought it home to each of us in our daily practice. I'm Dr. Regina Larac from the Division of Infectious Diseases, one of the leadership teams of the MGH Center for the Environment and Health, and we are deeply honored to have you as one of our colleagues here at MGH. You've been such a leader in making the connection between human health and climate change and the environment. And so thank you for an incredible kickoff to our symposium. I just want to share with those of you who are attending that you're welcome to put questions into the Q&A or into the chat. And we're running a little short on time, but Renee, I would love to hear from you as somebody who's really been at the forefront of bringing this subject forward. What you see as the hope for the coming years with the intersection of health and climate. Where are we headed? And what transformation have you seen over the time you've been working on this?
Well, thank you again. It's an honor to be involved, and I'm so inspired and thrilled to see what you all do leading the center. So thank you for everything that you guys are doing. So I have seen more movement in the past, I would say year to year and a half, than I have at any other time engaging in this. So the ground is shifting, which is phenomenal and inspiring, and it gives me hope among many things. We have a government and an administration now federally that is taking an all of government approach to climate change. So recognizing that we have to break down silos and think about it across every aspect. There is an office for climate change and health equity that is being formed within the Department of Health and Human Services, which is a first. And I think that those two words together, I think are really critical, because the goal of, I know my work and sort of other colleagues and all of ours, is to really put health and health equity as the central driver for climate action. This isn't about polar bears or icebergs. While I love both of those, this is truly about us. It's our own health, the health of our children, the health of our neighbors, health of our parents. And so I think as this switch happens and we recognize and these connections are made, that will hopefully set aside differences and provide a platform that everyone can agree action is needed. And so that is what inspires me most and what makes me most hopeful.
Thank you, Renee, and I share that enthusiasm as well. I think there is a lot of movement afoot, and I think in that vein, it is very exciting that here at MGH, we have taken the leadership role of developing the Center for the Environment and Health. And so I would actually like to now introduce Dr. Jonathan Slutzman, who is our director of the new MGH Center for the Environment and Health. Jonathan is also an emergency medicine physician here practicing at MGH, but fortunately also an environmental engineer who has tremendous background in healthcare and environmental cost modeling, and who has been a leader here at MGH in our clinician sustainability group. He's former chair of the Society for Academic Emergency Medicine, Climate Change and Health Interest Group, and also an advisor to Healthcare Without Harm. So Jonathan is going to talk to us about how the healthcare system contributes to and how the healthcare system can respond to the climate crisis.
Thank you, Regina. Just getting set up here. And so thank you so much for that fantastic introduction. And thank you, Renee, for enlightening all of us further. I'll say that Regina mentioned that I was a past chair of the Society for Academic Emergency Medicine, Climate Change and Health Interest Group. Renee was actually the founder of that group. So she set the stage there. My role today is to talk to you about how healthcare is contributing to the problem and what we can do to improve the problem of the climate crisis. And Renee touched a little bit about how healthcare really is at this nexus between needing to respond to the human health impacts of climate change, while also recognizing that the care we provide is a contributor to that same problem. So it's a vicious cycle that is our responsibility to break. And so to set the stage here, let's realize that if you looked at healthcare as an industry across the globe and called it its own country, it would be the 5th largest emitter of greenhouse gases on the planet. That's more than so many other countries. Now you might be thinking, okay, well, that's the whole planet's healthcare. What about more locally? Let's just look at the United States. Okay, if the United States healthcare sector were its own country, it would be the 13th largest emitter of greenhouse gases, larger than the entire United Kingdom. So healthcare is responsible for just under 10% of all greenhouse gases emitted in the United States. We are clearly a contributor to the problem, and it's our responsibility to take a more proactive role in protecting the health of our communities while we are also improving the health of the patients in front of us. We can dive a little bit more deeply into these numbers. And as Regina mentioned, I am an environmental engineer by initial training and practice. So I'm very much a numbers kind of person, with the idea that if we know more deeply what the sources of these emissions are, then we have a better chance of designing solutions to reduce our impact. So let's look at healthcare services in the United States as a whole. And what we see are graphs of the emissions, greenhouse gas emissions over time solely from healthcare. And what you first see is that it's reasonably stable with an initial slight decline and then again an increase in the last 5+ years or so. And these data go up to 2018, which due to modeling concerns are the latest available. And these numbers show that they're pretty large. If you look at it on a per capita basis, the United States is the largest emitter in terms of healthcare greenhouse gas emissions on the planet. It's really not even close between number 1 and number 2. If I remember correctly, Switzerland is number 2, but it's quite a big jump when you go from the United States to Switzerland. About 1,700 kilograms of carbon dioxide equivalents per person in the United States per year. Again, that's just under 10% of our average total. And the biggest chunk of that are what's labeled scope 3. And I don't expect most of you necessarily to know what those mean, other than recognize that scope 1, scope 2, and scope 3 are different aspects of our operations that contribute to greenhouse gases that warm the planet. With scope 3 being in healthcare the largest. So let's learn a little bit more about what those are. Our greenhouse gas emissions come from the care we provide immediately in front of us, with factors including the upstream components, things that happen before it gets to us, things like electricity generation or steam generation for heating, or all of the products that we purchase and the emissions associated with the manufacture of those products. Our direct emissions, neither upstream nor downstream, are the ones that are directly from our immediate operations. Things like, what are we doing on site? If we're burning any fossil fuels on site, for example, to cook our food, or the vehicles that we use to take care of our buildings and grounds, to transport our employees, patients, and visitors around town. And then our downstream activities, the emissions associated with our processing of waste products, our transport of waste products, and things of that sort. So we can divide into upstream, downstream, and on-site. We can also divide into these scopes, scope 1, scope 2, and scope 3. Scope 1, in the middle, are those direct emissions from things we do on-site. In healthcare, those are predominantly going to be combustion sources for heat on-site, or most importantly, anesthetic gases, all of which are greenhouse gases with varying impact factors. Scope 2 are indirect emissions for purchased energy, purchased electricity, purchased steam that we would then use on site. And then scope 3 is everything else. The largest components in scope 3 being the supply chain, things that we purchase, our equipment, our materials, our investments. What are we doing with the money that we then put into other entities, and their own emissions to some degree belong to us, and so on. So now that we have a little bit of a sense for what these three scopes are, we can take a little bit of a deeper look at the three scopes in US healthcare and what they represent. As I said, scope 3 is the single largest of the three impact factors in US healthcare. It's actually the single largest in healthcare around the world, with the component, the fraction that comprises ranging from 65 to 80%, depending on the specific country and the study that you're using and the methods for your modeling. It's not terribly important whether it's 67% or 75%. The key is that it really is about a 2-to-1 factor. It's about twice as large as the others. Within that, we have the supply chain being the largest, and we can break that down to show that pharmaceuticals are the single largest entity within scope 3 when you look at US healthcare as a whole. But food is a large component. This particular study did not include investments, and there are other data that would suggest that investments are pretty comparable in scale and scope to the larger parts of our supply chain. And then scope 2 and scope 1, the relative values of those are going to be very dependent on an individual site's factors, on how much they purchase electricity versus generate on site with perhaps a cogeneration facility, or how much they purchase steam versus burn a fossil fuel for their own heating on site. So this gives you an idea of kind of what are the sources of our greenhouse gas emissions at a healthcare facility, and MGH is not particularly different here. Why do we care about them? Renee touched a little bit on it, that really what's important is human health. And we can quantify that to some degree. And this same study that just this past year looked at the 2018 emissions from US healthcare looked at the health damages. And it's also important to note that climate change is one very important and very large, significant impact of our pollutant load on the natural environment, but it's not the only one. We emit other pollutants, such as particulate matter or nitrogen oxides that contribute to ground level ozone and smog formation, or sulfur oxides that generate acid rain formation. There are a whole bunch of pollutants that we release through healthcare and other activities in our daily lives, and they all have an impact on human health to some degree. If we just look at particulate matter and smog formation, which are the easiest ones to model the human health impacts, in addition to climate change, we can come to a number that gives us some measure of the morbidity on our community, on our patients, on our loved ones. And that number comes to be about 400,000 disability adjusted life years annually. You don't necessarily need to know what a disability adjusted life year means, but hopefully you'll trust me when I say that back in 1998, I think it was, the Institute of Medicine released their report, To Err is Human, pointing out that medical errors were potentially the third largest cause of death in the United States, and that it led to anywhere from 40 or so thousand to 90 or so thousand deaths per year. That spurred a huge movement in patient safety, congressional oversight, hearings, the creation of safety infrastructures and a safety culture in our healthcare facilities that is so important for providing safe, quality care to our patients. And I'm here to tell you today that the 388,000 or so disability adjusted life years lost annually due to healthcare pollution from our own healthcare services, is around the same order of magnitude as the risks from avoidable medical errors. So I call today that we should be working towards that same level of infrastructure and effort to reduce medical errors put towards a reduction of our own environmental footprints to provide environmentally responsible healthcare. Now we've talked about the world as a whole, we've talked about the United States, we've talked about the human health impacts. Let's dive even more deeply and look at the Massachusetts General Hospital. And what you see here are admittedly unaudited data from 2019, because the 2020 data are still in progress, of our Scope 1 and Scope 2 greenhouse gas emissions for the main campus. The main campus is huge. We treat thousands upon thousands of patients every year. Just in our emergency department, we treat well over 100,000 patients a year, with even more at our other outpatient facilities, and a huge number of inpatients as well. So we provide a lot of care, and this is just one measure of the cost associated with it. We've only included scopes 1 and 2 because although scope 3 is the largest for healthcare services, it's also, unfortunately, the hardest to quantify. So we are in process of creating a model to look at all of our emissions, including scope 3. But that's still a little bit of a ways away, and I wanted to share what I could with you today. So the first thing that you'll notice is that our Scope 2 emissions, that purchased electricity number of 0, is not an error. For a number of years now, the Massachusetts General Hospital, among most of Mass General Brigham, has been operating with 100% renewable electricity from primarily wind farms in New Hampshire. So produced here in New England for our use. That results in virtually no carbon emissions from our electricity, and that is a huge accomplishment for which all of us should be proud and thankful. Our purchased steam Looks big at 1.8 million kilogram CO2 equivalents. It's actually a pretty low number when you look at the emissions factor associated with it, because we purchase our steam as waste energy from an electric cogeneration plant in Kendall Square, where we built a tunnel underneath the Charles River to bring that steam to MGH for use. So we're doing pretty well there. Now we should look, okay, what's the next biggest? And the biggest number by far, at 60% of our emissions of scope 1 and scope 2, are our anesthetic gases. And we've touched on the idea that all of these anesthetic gases we use, sevoflurane, isoflurane, desflurane, and nitrous oxide, are all direct greenhouse gases that contribute to climate change of varying impacts. Desflurane is by far the most impactful, but thankfully it's also the one that we use the least at MGH for a number of factors. Nitrous oxide is our single largest impact among our anesthetic gases. And this 3.5 million kilograms of CO2 equivalents, the majority of that is nitrous oxide. So as we think about ways that we can make a difference, we should aim to reduce all of these, but let's look at where we can have the biggest impact and think about the care we provide and how we provide it and see what we can do about these numbers. So now let's talk a little bit, what can we do? So I'm going to talk a little bit at the end of this symposium as we meet the team about what the MGH Center for the Environment and Health is aiming to do initially with a bunch of initiatives. But here I'm just going to touch a little bit on essentially our 4 pillars and the things we can do. We aim to create new knowledge on the inextricable links between environmental degradation, pollution from healthcare services, and human health impacts. And we aim to create new knowledge in how to deliver environmentally responsible, climate-smart healthcare services to reduce our impact, to mitigate our impact as we show the world that it can be done, and we really take on the moral imperative of taking care of the patient in front of us without harming other people in our community as much as we possibly can. So what kind of research can we do? We can do lots of kinds of research, and I'm just going to show you one thing that we've done here, and that's a waste audit of our emergency department that we conducted just 2 summers ago in 2019. And what we could do is we could collect our waste for one day and say, what's in it? What are these things that we're finding, that we're throwing away, that can then be inputs to a model on our total environmental impacts that can help us to target ways to reduce our waste generation. And we can learn things like, wow, that's a lot of plastic that we're generating. Well over 60% of the waste that we generate in RED on this particular day was plastic. And keep in mind, this was pre-COVID pandemic. So it doesn't include a lot of the PPE that we're using with such great frequency now. We also see that we're generating about 10%, a little bit more than that, of our waste goes into red bags, regulated medical waste. More importantly, I can tell you that 85% of the items in the regulated medical waste didn't actually have to be there and were treated as regulated medical waste when they could have been treated as standard municipal waste, which would have reduced the environmental impact of treating it, since it all has to be rendered biologically safe. And we see that our recycling is a relatively low proportion. We also see that we have relatively high potential for recycling, but not as high as you might think, just because the market for plastic recycling is negligible right now. So really our best chances for recycling are in glass, metal, and paper. And then we can turn these data into a model to say, all right, well, we have to get rid of these wastes. What does that look like? And it turns out that the pollutant emissions of getting rid of one day of emergency department waste was equivalent to driving an average automobile 7,700 miles. Now, my commute is thankfully pretty short. 7,700 miles is more than I drive my car. So 1 year of driving my car is equivalent to 1 day of waste from the emergency department at MGH. So research, we can do that. We also aim to educate. And you're all here today as one piece of our education initiatives, and we're going to be doing more. We're going to be having monthly seminars that anyone can attend to talk about climate change, environment, health, and these links. We can educate our trainees, our residents, our students, our staff, our faculty, and our community on these links so that they can learn more, be more educated citizens, and can advocate more on their own. Speaking of advocacy, we can do that. We can aim to protect our communities and impact community health through advocacy, either in public policy, on Beacon Hill, in Washington, in other places. We can aim to work with our regulatory agencies, be it public health, health and human services, energy and infrastructure, and most interestingly to me, our accreditation bodies, because so much of what we do is impacted on by those accreditation bodies and governs some of the choices that we can make. And we can impact our practices. Single-use disposables are an easy target, relatively speaking. Almost every single life cycle assessment study that has been published has shown that single-use disposable instruments and equipment in healthcare are worse environmentally, and the studies that have included financial modeling have shown that they cost more too. And we can adjust our prescribing. These are just 2 ways that we can change our practices, and there are plenty of others that we can think about. Now, what can you do? You can join our network. You can incorporate an environmental lens to your work, and we can help with that, whether it's research or clinical care or education. You can learn more yourself and share that knowledge. And then you can think of the environmental and subsequent health impacts of the care that you provide. So I, as everybody else, want to thank you all for joining us today. I look forward to any questions you might have and to continuing the conversation through the rest of the morning.
Jonathan, thank you for an incredible overview of where we are within our own institution. It's really a humbling reminder of the work that we have ahead as a hospital system and as a healthcare system to tackling some of these issues. I just want to raise one of the questions from the chat, which I think you addressed it pretty well, but beyond just our greenhouse gas emissions, waste is obviously a huge issue from the healthcare sector. And you touched a lot on that with regards to your emergency room audit, but I wonder if you could just comment a little bit more about the challenges of waste reduction in healthcare.
Thanks, Regina. Waste reduction in healthcare is a big challenge. I like to call waste or waste auditing the gateway drug to sustainability science, because it's the kind of study that doesn't take amazing expertise to do, and just about anybody can do it, and you get so much information from it. There are a lot of challenges. One is the red bag waste problem, where we have potentially biohazardous material that needs to be rendered safe before disposal. Another challenge is that so much of our equipment is packaged in plastic that really at this point it's just not recyclable and becomes just waste. And as you mentioned, Regina, it's made from fossil fuels. So we have some challenges in the disposable culture in healthcare, in managing compliance with regulatory bodies, in ensuring patient safety while balancing the patient in front of us against the general public health, with diminishing returns in some of our, I think, infection control measures. So there are a lot of factors in waste management and improving our waste practices that are a little bit more subtle and a little bit more challenging, but it doesn't mean that they're not surmountable. Well, we are at 9:30, right on the button now, so I'm going to turn it over to my colleague. I think Patrice will be introducing our next speaker.
Hey, Patrice, you're muted.
Thank you. Apologies for that. I'm delighted to introduce Gaurav Basu, MD, MPH, a physician and founding director of the Cambridge Health Alliance Center for Health Equity, Education, and Advocacy. He is an instructor at Harvard Medical School's Department of Global Health and Social Medicine and a Health Equity Fellow at the Center for Climate, Health, and the Global Environment at the Harvard T.H. Chan School of Public Health. Dr. Basu has a background in human rights and global health and has received numerous awards in medical education, notably the Charles McCabe Faculty Prize in Excellence at Harvard Medical School. He co-directs the social medical curriculum at the Harvard Medical School and the HMS Task Force to address racism. Dr. Basu has been recognized nationally for his work in climate change and health equity, and has also received the Union of Concerned Scientists 2020 Science Defender Award. His perspective pieces have appeared in the Boston Globe, Scientific American, the British Medical Journal, and he's been featured by National Public Radio in All Things Considered. He's currently a member of the Robert Wood Johnson Foundation Culture of Health Leader Program. Previously, he has worked at Partners in Health, the Child in Need, and the Gates Institute. Dr. Basu's wife, Sudha Natarajan, is an esteemed graduate of the MGH Institute of Health Professions, where I teach and lead the Center for Climate Change, Climate Justice, and Health. And Sudha Natarajan is a nurse practitioner at the Massachusetts General Hospital and a climate and health advocate. Welcome, Dr. Basu.
Thank you so much, Patrice. It's great to see you. Everyone hopefully can see me okay here. And first want to just congratulate you all at MGH for this amazing endeavor, and grateful to see a lot of friends, Jonathan and Regina and Tina and Patrice, and really grateful that you've been doing a lot of leadership for a long time, but grateful that this can coalesce within a center and move forward in this kind of critical moment of climate action. So I am going to share my slides here. Just bear with me one second. All right. So, and also really grateful to join Renee and Elizabeth and Jonathan in speaking today. All right, so I will expect someone to tell me if my slides are not showing up properly. But I am going to lead a conversation here over the next half an hour or so, focusing on equity and really talking about climate change as an issue of health equity, environmental justice. But every time I talk about climate change to any audience, I take a moment to just recognize the emotional taxation of this work. We're living in an extraordinarily hard time. We are living through multiple crises that are happening at the same time. And I actually think that how we handle the emotions of that, how we embrace the bignesses of our challenges, the fears it might elicit in our professional lives and our personal lives, is a critical part of how we step into action. So I just want to acknowledge that this is scary and hard, and that building community by making things like a center is so critical for us to find the solutions that we need. This has been touched upon throughout the morning, I know, so I'm just going to touch upon it. But the way I think about the intersection of climate change, fossil fuel, infrastructure, and health equity, I think of it as 9 major ways that they're connected. I think about the ways that climate change impacts natural disasters, food insecurity, water scarcity, infectious diseases, heat-related diseases, burning of fossil fuels causing air pollution impacts, mental health, forced migration, and political conflict. And I want to upfront just define this notion of environmental justice. Some of you are familiar with that term. Some of you are working hard on this area of climate change and environmental stewardship. But I just want to make sure that I kind of provide a definition up front. And this is how the EPA defines it: the fair treatment and meaningful involvement of all people, regardless of race, national origin, or income, with respect to the development and implementation and enforcement of environmental laws, regulations, and policies. So I appreciate the incorporation of the meaningful involvement as well here. We have got to make sure that frontline communities are a part of explaining the environmental burdens on their communities and are part of the policymaking process. Where my mind is right now, as we're starting to see vaccinations improve, cases of COVID decrease across our state and country, is to, again, just really reflect this extraordinary moment in history. We are going to be looking back, future generations are going to look back at this moment in time and wonder what it was like, and wonder what we were thinking and how we decided to make a new future. And you see these pictures here. This is California wildfire decimating a senior citizen center, while there's a sign there saying to wear your mask. We are reckoning, we continue, a day after the 1-year anniversary of George Floyd's death, to reckon with our history of structural racism. And these big historical problems certainly can overwhelm us. It can paralyze us. It can make us feel like there's no other way forward. And frankly, it did that for me. It really paralyzed me for a while. I have now come to a headspace where I have embraced the bigness of these issues. I've really been able to really feel within myself the intersections of these issues, and have felt like making change thoughtfully and ambitiously and courageously allows us to make so much change at the same time. So I would encourage people to consider embracing the bigness of this moment. You all have done extraordinary work to take care of our communities this past year. We have taught ourselves what we are capable of in ways that we may not have even realized prior to COVID. And that gives us an opportunity to continue that work into the future. We can't be forgetting these crises that we have come so deeply face to face with this past year. This adage that every system is perfectly designed to get the results it gets is something that's on my mind, because we don't want to go through what we went through this past year. And the climate crisis poses this threat of continual upheaval and social instability. And so we've got to do a systematic analysis of what's going on here. And so environmental justice is often a term and framework that is used in understanding issues of equity in climate change. I also want to embrace the work of structural racism as a term. Dr. Kamara Jones, which many of you know, a former APHA president, provides a definition that feels very important to me. So it's a system of structuring opportunity and assigning value based on the social interpretation of how one looks, such that it unfairly advantages some individuals and communities, it unfairly advantages other individuals and communities, and it saps the strength of the whole of society through a waste of human resources. So this is really a lens, this definition really resonates with me when I look at climate change. That we've got to look at the underlying systems, the ways in which our fossil fuel infrastructure has organized opportunity and lifestyle for some people, and how it's disadvantaged others. If we really do that reckoning, we have got to come eye to eye with the fact that our fossil fuel infrastructure is disproportionately loaded into communities of color. The bridges, the freeways, the actual infrastructure in places like Weymouth and East Boston are loaded into these communities of color, and is causing disproportionate harm there so that it can benefit others. But it saps the strength of the whole of society through the waste of human resources. So what does that mean a little bit more concretely? This is an important study Jeremy Hoffman down in Virginia did, which analyzed red line communities versus non-red line communities. So let me just make sure we know what redlining is. In 1934, the Federal Administration Act, federal policy had explicitly racist language, encouraging banks and mortgage companies not to invest in communities of color. And what they did is they produced 239 maps that literally had red lines around communities of color, and said that encourage you not to invest in these communities, and had explicitly racist language in this act. What Jeremy Hoffman was able to show is that those red line communities are 2.6 degrees Celsius hotter than non-red line communities. And we've got to create the connections here. We've got to connect the dots between the lack of that investment and the heat that these communities are exposed to now. This redlining was in a policy for 34 years until the Fair Housing Act of 1968. So for decades, investment was being pulled out of these communities, pulling away opportunities for green infrastructure, for tree canopies, for vibrant communities that were taking away, streets and replacing them with infrastructure that allowed biking and passive transportation and vibrant public squares. Right now, in the midst of the infrastructure debate, there's a lot of conversation about the role of highways in structural racism. So an analysis, this is a good study here by Archer, showed an analysis of how many highways, there's really important studies showing, like in New Orleans, right now Pete Buttigieg is analyzing through the Civil Rights Act, a freeway in Houston, and the ways in which highways were built, freeways were built, to transect communities of color, which impacts the community vibrance. It disproportionately exposes those communities to air pollution. And we've got to, again, reckon that we put those highways in some places and we didn't put it in others. That is the manifestation of the history of structural racism here. And that is the way in which environmental justice and injustice plays out in our society and country. There's many ways that we can draw the connections between COVID and climate and environmental injustice. This is just one study that I'll present that was done at the Harvard School of Public Health, was one of the seminal first studies during COVID, showing that chronic exposure to particulate matter 2.5, a dangerous form of air pollution, causes an 8% increase in mortality for individuals who have chronic exposure to air pollution. So if you have lived in polluted communities over time, if you are infected with COVID, you are more likely to die. So again, this shows the way these are interconnected. This is a study that came out just about a year ago, showing other issues of equity here, presenting the association between air pollution and heat with premature labor and low birth weight and stillbirth. This is a study that just bothers me at my core. The idea that we would allow expectant women to be exposed to these threats to their own bodies and to their fetuses is completely unacceptable. And of course, future evaluation of the data showed that Black women's had the highest pregnancy risk. This is just something that kind of keeps me up late at night. Other studies here, Union of Concerned Scientists, I kind of spotlight this as a kind of very local study in Massachusetts, shows this was exposure to transportation-based air pollution, and you can see which communities are disproportionately impacted and which are not. So I'm going to just present briefly a case here that helped me in my awakening of climate change. And so there was a 30-year-old patient with asthma who moved to the United States about 5 years ago from Central America. There in his home country, he was a farmer, he was a parent of a young child. He had had persistent upper respiratory infections, but then increasingly had symptoms of shortness of breath, orthopnea, headache, and fatigue. And tragically came to our emergency room and was found to have kidney failure. He had end-stage renal disease, had to be hospitalized for urgent emergent dialysis. This young man was, his understanding was that he was in full normal health, and it was a devastating diagnosis for him. And as the evaluation continued, he was diagnosed with Mesoamerican or CKDU, chronic kidney disease of unknown origin, which is increasingly understood as a kind of syndrome that we need to be thinking a lot more into the future. Now, there's a lot that needs to continue to be studied about these renal diseases and the ways in which environmental exposures may be causing people, young people, to have kidney disease. But there's a clear understanding that mechanisms of heat may play a role, and that through dehydration day in, day out, that farmers, particularly in Central America, there's a great prevalence of this disease, are out in the heat day in and day out, not realizing that they're getting dehydrated and having injury to their kidney over years, and then presenting at very end stage, completely upending their lives. Heat impacts everything we care about. It impacts every organ system. I think it's one of the most important things that we target, exposure to severe heat here locally and what's impacting our patients. And where I practice in Middlesex, it's important for us to realize that the Northeast is warming at a greater rate than the rest of the country. My county is 70% faster, 1.7 degrees Celsius post-industrial warming. We don't fully understand why, but this is here now. It's impacting our patients now. And it's important, this is a piece that Martha Bebinger had presented, that heat impacts communities differently, and that many communities like Chelsea are heat islands, which means that there's disproportionate asphalt and concrete instead of tree canopies and parks. You can connect that back to Jeremy Hoffman's study of how that came to be. But Chelsea was a red line community. But it's important to understand that on days in Cambridge, where I live, that are 95 degrees, it could be up to 110 degrees in other communities because there's nothing to create shade and protection against the heat. I want to just say a quick word also that we've got to also embrace the global implications of climate change. This was a piece I wrote last year when Cyclone Amphan was bearing down on the Bay of Bengal area, the area of the world that my family is from. Poor coastal communities were wiped out by a super cyclone, even in the midst of COVID. As we speak right now, Cyclone Yas is going through the exact same area. I was emailing with the nonprofit I work with there, and it looks like it is just avoiding their communities that they take care of and going just south of them to other communities. But this is happening year in and year out and making parts of our world uninhabitable. So where do we go from here? Well, this is hard and this is tough and this is overwhelming at times, but it's also a profound opportunity to make change. It's a way for us to reimagine the future and have the courage to make it. And so we've got to define our values. We've got to make the choice to do the deep work that reflects those values. And they've got to be organizing principles. They've got to be embedded in everything that we do. And that's why I really love the way that the center is approaching their work. It's not just that climate work is over here on the side and our clinical work is here. It's fundamental to our clinical work. It's fundamental to our professional responsibility to understand the ways that climate change and planetary health is impacting our patients and our opportunity to be a part of the solution. But it's got to be central to everything that we do. And we've got to see ourselves as a part of this work. The thing is that the solutions are everywhere. And this is the part, and I know this is touched upon throughout this morning, but that we have got everything we need to turn course. We've got everything we need to make a just, sustainable, clean future in which our patients, our children thrive, but we have got to put it at the center of our work. I'm going to just run through these quickly and then hopefully take some questions. But what do we do? And Jonathan just touched upon many of these. I'm going to just touch upon them also and be brief because much of this has been covered. There is this focus on lowering our own carbon footprint. That's been important for me personally and my family. We have a garden outside. We're thinking about our, how we use public transportation, the way we eat. That puts me in better relationship, I think, to this work, so that I am I feel like my own lifestyle is a part of our values. But I want to make the point that what we need here is structural change. Just creating fossil fuel infrastructure and asking us to navigate through the labyrinth of fossil fuel infrastructure is not doable. It's not effective, and it's not the right approach. We've got to make the structural change we need so that our patients are able to thrive. And so these are some questions I think about. What systems do you want to change? What communities do you want to be a part of? Where do you find your power, strength, inspiration? What roles can help you be most effective? What issues do you want to spotlight? And what world do you want to make? Climate change is hard, and we can define all the problems that climate change presents, but we also have to have a vision of what kind of world we want to make and take concrete steps towards making that. This is a study just showing that primary care doctors, and primary care doctors, so I'm going to spotlight that, are the most trusted voice in this study on climate change. I know Patricia showed me remarkable data about how the role nurses play in promoting climate action. So we have this profound opportunity to put our voice into this work and we can leverage the trust that we have with our patients in them knowing that we're there for their health and to make the connections with climate action. This has been touched upon as well, I believe. Obviously, this is at the center of the center's work, but decreasing carbon footprint. I won't go into detail much here, but we've got to look at everything around us within our work and how we can decarbonize everything from our energy systems to food systems and our shuttle buses, et cetera. I want to say a word of divestment. There's been an overwhelming vote that happened last year from the Medical School Faculty Council to endorse divestment. It's something that we got to think about. Does it make sense that we invest in fossil fuels in our portfolio if that's what's causing harm to ourselves and our patients? Medical education plays a critical role in this, and I'm very glad that the center will be doing a lot of work on this. We're not going to be able to make this change unless we teach our future generations of clinicians that this is a part of their work. And we've got to do much better in making curriculum across the board in all of our training programs, in residency programs, interprofessional opportunities across the board. This is Mary Rice in a piece where she talked about, as a pulmonologist, how she talks about air pollution and pollen exposure to her patients in the clinic. I think this year has shown us a lot of role models of how to message public health carefully and clearly, and we should be doing the same thing with climate change. This is an amicus brief. Renee was a real leader in this. Regina was a real leader in this, in partnering with lawyers and understanding the legal rights of a safe climate. What legal rights do our children have? This is a great example of how clinicians partnered with the legal system to present a legal framework of why we need climate action. And then legislative advocacy. We've got to show up in our city councils, at our state houses. Often these conversations and policies are being made without a political voice, or even consider running for office, because we need these voices within the halls of power. We need robust policy change. For me personally, writing has been a really great outlet for education. These are some op-eds that I was able to write. This is a community climate gathering that we've done at our home in our basement. Regina has been to some of these. This is Marjorie Decker, my state rep, who came and spoke to us about the policies that she was presenting in the State House. And I'm going to go very, very quickly through these, but I just want to overall make the point that there's profound sources of hope and courage. Coal is in free fall. We've got to make a just transition so we make sure that we create jobs for people who are losing them. But it is economically unviable to have coal as a energy source. On the other side, there's exponential growth in wind and solar. These are batteries, and the capacity of storage opportunities in batteries to store energy for more clean energy. Natural gas now is being shown very soon into the future, not viable economically. We've got to put a spotlight on the impacts of methane. That's disproportionately impacting communities of color. And just a quick word, I'm not going to go through all of these studies, but 2020 being a major election year showed a sea change in the voting patterns of people and how much they cared about climate change in their voting decisions. And yes, this one on the top right here shows that Democratic voters put climate change at the top, and there is some partisan, split in some of these scales. But look at the top left here. Overwhelmingly, people want climate action. They think of it as one of the several important issues that bring them to the ballot box. We've got a lot of commonalities that we don't highlight enough. And frankly, for me as a patient, as a parent, I spotlight, connections with other parents across the political spectrum of how we can find common purpose in taking care of our children. And the federal government is now taking really serious action. We have got a champion in the White House, Gina McCarthy, of course, who is with us here at the Public Health School for many years, is leading the office in the White House. We're doing serious business at a federal level. There's critical policy that needs to pass. But I just want to emphasize again that policy change gives us profound opportunities to have a decade of action. And 10 years from now, we've got to be at a place where we look back and say, this was the moment. This was the moment that we realized how much climate action improves our health, our well-being, our children's future, and we put in the resources and the policy change needed to secure that future. I'm just going to put a quick word here. These are a couple slides. I know that I'm going a little bit quickly. I added a few slides at the last minute, but I just want to make a point of the importance of state-based policies. So this is just showing us a bar graph of the different states that have committed to 100% clean energy mandates. And look at how much that's included. This is an old slide now from 2019. The bar is much higher now even. I'm not going to go through all of these, but these are just a handful of like some great policies that are being done at the state level. Elizabeth's going to come on after this and tell you about what the great work she's doing in Massachusetts. And ELM is a great example of how to partner with our local government to make important state-based policy. And just to spotlight again that Massachusetts passed a very serious bill. I really thought there was a lot of important provisions in there. We've got to continue on and every year in and year out create improved state-based policies, but it was a serious and important moment in our state's history in climate action. This is happening internationally as well. China is saying they'll be net zero by 2060. Europe is committed to its own Green New Deal and decarbonizing. The UK has been a leader in this. Private sector has now been trying to embrace. So we've got to create accountability for all these companies to make sure they get to 100% clean energy. But there's important commitments that are being made. But ultimately, I put my faith in what's been happening in the youth movement. I believe that climate change is fundamentally an issue of our interconnectedness and our common humanity. For me, the work of climate change is us taking better care of one another. And it can feel disconnected that, transportation system and energy system and methane and food systems and agriculture can feel distant from our clinical work. And I ask you today to try to find a way, engage with the center, communicate with the panelists that you're hearing from today, find a way in which you can take one step forward to be a part of the solution. I guarantee you that climate change impacts the things that you care about in a personal and professional way. I take the moment to feel overwhelmed if you need to, because I've had, those months of feeling like that. But I am certain that there is a way in which you can play a part in creating that future we all want together. This is an extraordinary moment coming, hopefully out of COVID into better future. We have got to make the structural change. This is a decade of action, which we've got to catapult forward. And I'm really confident we can do it if we find our collective will. And again, clinicians, I think, are really at the forefront of this work. So thank you so much for having me. And I will pass it back to Patrice.
Thank you, Gaurav, for the inspirational offering. It's truly so critically important that we address environmental justice, climate justice, and you've given us a call to action, and we thank you.
Thank you so much, Patrice, and thanks for all you're doing. I've learned a ton from your center, and creating centers like this, at IHP and MGH allows us to create community, and I think really define our principles and really kind of come together. And I think climate change is a thing. Once you see it everywhere, and frankly, it is hard to see. It is hard, it can feel abstract and can feel hard to really see it day in and day out. It's a beautiful day today, right? But in the Costa Bay and Bengal right now, there's a super cyclone, and there's clear scientific evidence that our warming oceans and our warming climate is causing an increased rate of these super cyclones. So we have got to see the connections in all of this and put one foot in front of the other into making change.
Thank you, Gaurav.
I'll echo the thanks. Gaurav, you've been an inspiration to all of us in the Boston area with your committed voice on this topic. And I think that the direct connections to the affected communities that we have locally is a really important component of the work that we will be doing with the center. And so thank you for framing our collective responsibility on this. So speaking of collective responsibility, I'm really happy to introduce our next speaker, Elizabeth Henry. Elizabeth is a wonderful friend to MGH. She is the director of the Environmental League of Massachusetts, and she's been in that position since 2017. ELM has really been a leader in the state in developing our ambitious goals and pragmatic strategies for dealing with the climate crisis. Elizabeth has led the ELM Corporate Council, which is a collection of business leaders and leaders in the Boston community to match the urgency of our policy response to the challenges that we're facing. So Elizabeth is going to talk to us today about kind of the landscape of how we address the climate crisis here in Massachusetts, where we've been and where we're heading. And I'm delighted to say that Elizabeth was named number 34 on Boston Magazine's list of the 100 most influential Bostonians. So what an honor. And we're so happy to have you here with us today. Feel free to put questions in the chat as well during Elizabeth's talk, and we'll bring them up at the end.
Thank you so much, Regina. So I am Elizabeth Henry, president of the Environmental League of Massachusetts. For those that don't know us, ELM is the state's oldest environmental advocacy organization. We turn 123 next week. We're based on Beacon Hill, and we've been pushing for Massachusetts to lead the nation in responsible environmental policy since 1898. Over the decades, we've helped to pass policies that were firsts, from early land and water protections to path-breaking laws for acid rain and brownfields or toxics reduction. And over the last 2 decades, I think understandably, our focus has been increasingly on climate change. We were proud to be part of the landmark Global Warming Solutions Act in 2008 that set a legally binding target for emissions reductions. 2016, we were proud to help pass the nation's first offshore wind procurement. And in 2021, we helped to pass the roadmap bill that I'll talk about shortly. I'll say I'm really proud to join the advisory board for MGH's Center for the Environment and Health. And I'm equally proud that Mass General Brigham, and before that Partners, has been a committed longtime member of the ELM Corporate Council. So my job here today is to share some highlights from your track record in state policy advocacy, and also highlight some of the key issues under consideration by Massachusetts lawmakers on Beacon Hill in the next 2 years, to sort of give you a sense for how this center can continue to engage. So to set the stage, I think you can be proud of Mass General Brigham's relatively high level engagement in state environmental policy advocacy. As I look back to our years of lawmaker education days, I can't actually recall a day when practitioners, your healthcare community was not an active participant in our lobby days and in lawmaker education days. And I just want to underscore how significant it is that the state's largest private employer and one of the Commonwealth's most trusted institutions and brands has been such a consistent and effective advocacy partner on these issues. It is also significant and frankly unusual for a center at a hospital to have a policy advocacy as a stated pillar. And I think it's a testament to how deeply this center in particular, and Mass General Brigham as an institution, understand that we need structural systemic changes. You've heard from presenters so far today that point that the cumulative sum of our individual actions is going to be insufficient. We will never get to a healthy, equitable, net zero emission society, and certainly not by 2050 without some really fundamental policy intervention. You've heard that by 2030, which is less than 10 years from now, Massachusetts and the nation need to have delivered a 50% greenhouse gas reduction. And it is daunting, but it is doable. I also think that it's important and strategic that MGB has chosen to engage at the state level. States are laboratories for democracy and for policy innovation. Over the decades, Massachusetts has repeatedly proven that it can do for environmental policy what we've done for healthcare, for marriage equality, that we can pilot and implement leading edge policies that eventually become norms in other states and nations. I like to say that we are a small, smart state. We're a place where federal leaders and other states policymakers look to for policy solutions. And as part of that, we're also a litmus test. When Massachusetts rises to meet a challenge, others see that it's possible and are emboldened to try. When we fail to rise to a challenge, others can infer that it is insurmountable and they might give up. So even though we're small, the impact of our actions really do extend far beyond our borders. So I want to share 3 highlights from how Mass General Brigham has engaged in state advocacy recently. First, you may know that in March of this year, Governor Baker signed the 2050 Roadmap Bill. This was a big deal. It updated our 2050 emissions goal to be net zero, and it set legally binding emissions reduction goals for 2030 and 2040. It's called the Roadmap because it is the policy roadmap for how we achieve a decarbonized future. The Roadmap Bill also included some really key environmental justice protections that have been 20 years in the making. These protections give low-income communities and communities of color more input and power when it comes to siting infrastructure and fighting against pollution. And you should be proud that Mass General Brigham joined us in advocacy for both the Roadmap Bill, and you signed a special letter in support of the EJ protections. Second, as an institution, both as an institution and many individual healthcare practitioners have been really vocal advocates for curbing tailpipe pollution and doubling down on investments in clean mobility. Dr. Basu, in fact, I'm going to drop this in the chat because it's so good. Dr. Basu wrote a wonderful op-ed in the Boston Globe, which I love, about how a clean transportation system is the prescription his patients need. And Mass General Brigham joined in advocacy for the Transportation and Climate Initiative, or TCI, which was just adopted last December. TCI is a regional program that puts a cap and a fee on carbon pollution and then uses that revenue to reinvest in public transit and active mobility, like safe walking and biking corridors and in electrification. And MGB support was really significant. You know, the governor needed to see that it wasn't just environmental groups that were supporting, but businesses and organizational voices like yours were essential for building the political will to join this initiative. And as it turned out, when the dust settled, you guys were in really good company with many, many leading businesses and employers and organizations supporting TCI across the state. And third, you have been supportive of renewable energy, particularly offshore wind. And this is important because by 2050, many economists and energy analysts, in fact, even the state itself, expect that offshore wind will power half of the New England grid. So that means that 1 in every 2 electrons are going to be coming from wind off of our shores. 1 in every 2 cell phones and refrigerators, MRI machines and computers will be powered by offshore wind. And Mass General Brigham has repeatedly advocated in support of the responsible build out of our offshore wind industry, including most recently signing a letter with other businesses and organizations to the Federal Bureau of Oceans and Energy Management. So you have a strong advocacy track record to build on, and that is good because there's still a lot of work to do. Every 2-year legislative session, somewhere around 7,000 bills are filed. We're not going to talk about all 7,000, but I'm going to spotlight 6 that I think are 6 of the most material environmental policy opportunities on the horizon in Massachusetts for the next 2 years. I will also drop into the chat ELM's full list of policy priorities if you'd like to learn more about how we are investing our time and energy. So first, I will return to offshore wind because I do believe strongly that this is going to be the workhorse of our clean energy transition. And I'll spotlight a key bill that will cement Massachusetts' leadership as a hub for offshore wind and ensure that we are shaping an equitable and responsible industry. This bill authorizes additional offshore wind procurements. It promotes minority economic participation for the first time. It adds funding for research and workforce development, and it encourages private, institutional, and municipal procurements, such that Mass General Brigham could just go out onto the market and buy offshore wind itself if it wanted to. Second, you've heard from panelists that tailpipe emissions are certainly compromise human health. They're also the single largest source of emissions in the Commonwealth. And so there's a key bill to decrease emissions from transportation by accelerating the transition to electric vehicles with a focus on fleets. So we're pushing to require the state to electrify all public transit. That includes MBTA, rail and buses, regional transit authorities, and public fleets like school buses. It would also set timelines for doing so. Third, this is not necessarily the most visible, but it's arguably one of the most important components of us being able to achieve our goals, is the state's environmental budget. We need to resource our state agencies so that they can carry out these essential and broad responsibilities. You know, it always surprises people to hear that we only invest about half a penny of every dollar of our state operating budget into the environment. And our agencies lack the staff and resources to meet their mandates and implement the environmental laws that we pass. So this year, we have targeted 5 strategic line items that particularly deserve more resources, and MGB will be invited to support those along with us. Fourth, buildings. If transportation is the #1 source of emissions in the Commonwealth, buildings are #2. And we must ensure that new buildings are constructed to high standards and begin to really address retrofits in a meaningful way. I'll also say personally, I think buildings are going to be one of the hardest sectors to decarbonize. And so it's important to start now. That lawmakers will be considering amending the state's energy efficiency program to support, which is called Mass Save, to support populations historically underserved by the program. They're also going to be looking at updating our building codes, investing more in energy retrofits, and removing state funding for switching from oil to gas. Fifth, waste. Dr. Slutzman, I was stunned by some of your figures. I have heard from so many at Mass General Brigham about how troubled you are by the packaging and waste associated with healthcare delivery. I don't have a silver bullet. There is not a silver bullet that lawmakers will be considering this session, but there is a really interesting extended producer responsibility bill that will reduce unnecessary packaging and promote effective recycling and help municipalities and institutions like you avoid increasing waste disposal costs. Essentially, it would require manufacturers to pay into a fund that will support programs to reduce solid waste. And finally, environmental justice. Many EJ communities are overburdened by polluting facilities in their neighborhoods, as you have heard from several of our panelists today. And this is in part because of structural failings within the governance body that is responsible for siting energy infrastructure. It's called the Energy Facilities Siting Board, or EFSB. There's a great bill to reform the EFSB that ensures EJ communities are represented and able to participate in the decision-making process. So I wanted to make sure that there was plenty of time for questions if folks had them about advocacy opportunities at the State House this session. So with that, I'm happy to turn it over.
Elizabeth, thank you for a wonderful overview of the kind of situation we have here in Massachusetts. And thank you for reminding us that our work in our own state is really very powerful, both in impacting our own communities, but also in leading the way on a lot of policies that we need for renewable energy procurement. Could you just tell us a little bit? I think for many of us who are practicing healthcare professionals, the idea of how to engage with this topic is sometimes a little bit daunting. And I wonder if you could just give us your thoughts on, how do health professionals play a role in voicing concerns, in making policy change, but what's achievable within our own sphere of influence? How do we do it?
I think you do a beautiful job. I think the 2 keys to successful advocacy are being prepared with the facts and speaking from the heart and speaking from your own experience. And healthcare providers have a unique, both moral responsibility and credibility, as other panelists have talked about. And you are seeing this intersection of climate and health in a real, raw, and visceral, and oftentimes, at the individual level. So it's easy to be intimidated, right, by that big gold dome and by all those. There's 200 lawmakers up there. Which door do you knock on? But partners like the Environmental League of Massachusetts, the Healthcare Without Harm, others are standing by to help bring you into the building, to help invite you to tell your stories to the right lawmakers at the right time. I mean, that's a big part of how Mass General Brigham engages with ELM. There's 7,000 bills. Which ones do you get involved in? Which ones might move? Which ones are material? So we are your guide and your partner to help disambiguate that, and curate those advocacy opportunities that really do have the potential to have a real impact. And no one is perfect, right? You're never going to be perfect, but it really does matter. Before I was in this role, I spent 7 years running the climate and energy program within Adidas's owned operations, the shoe company. And I was surprised when I started at ELM how accessible my state lawmakers actually were. those of us that have spent time lobbying in Congress expect our state house to be impenetrable, and it is actually mostly filled with real people who are trying to do the right thing, and people that really want to hear from you. So I'm looking forward to continuing the partnership and advocacy. And please, I'll drop my email in the chat, but would love to, if anyone has questions that they want to follow up with one-on-one about how to be an effective advocate, I'm happy to talk anytime.
I'll just read one of the comments from the Q&A. Thank you for your responses. I think the world will listen if hospitals across MGB and other high-profile public health institutions begin to prioritize these questions as public health issues. This will help to motivate and to normalize this necessary change. I think I just want to agree with that statement, which is really that our voices as health professionals really brings the concerns about environmental degradation and climate change immediately into people's lives. And that we, as we've seen from some of the data Gaurav showed, health professionals are particularly trusted voices on this topic. Elizabeth, can you comment on, what is the best way for health professionals to talk to legislators? What information do we need to convey to them, and how do we do it effectively and not feel overwhelmed by what we don't have on hand in terms of facts? How do we use our voices most effectively?
Question. I mean, particularly after the year that we've had, I think people are seeing the intersections between climate and health in new and surprising and interesting ways. The study that came out of Harvard, for example, about the I'm not sure if all of our listeners saw it, but it was quite eye-opening, and it showed that increased exposure to air pollution intensified people's symptoms and it intensified the experience that the reactions that they had if infected with COVID-19. And to be able to spotlight some of those stories like that are quite effective for lawmakers. Another thing, the Massachusetts state budget is about $46 billion a year. Fully half of it is for mass health. 1 in every $2 of our state budget go to keeping people healthy and treating them when they are sick. And there is a sort of a bottom line argument too that some healthcare providers are really able to make. The benefits of prevention, the benefits of cleaning our air and cleaning our water, of keeping people cool during heat waves, is really could accrue to the state's bottom line in a significant way.
Thanks. I think that's a really great point, Elizabeth, that, just telling the story of what we have knowledge and experience with is, and connecting it to large state expenditures for health is a really effective way for us to be involved. We don't have to know the science behind carbon dioxide warming the atmosphere. So I wanted to invite Dr. Tina Duhane. She has a question for you also. And Tina is, of course, one of our leaders at the MGH Center for the Environment and Health. So Tina, why don't you say something?
Elizabeth, that was a wonderful talk, and it really kind of helped you get over the jitters of approaching advocacy, because many of us have never done anything like that. My question is for people who aren't going to go talk to legislators, but want to know how to vote for these issues, want to be informed as to, which candidate has which platform, which bill they should support. Can you give us there's, people get overwhelmed. There's so many things that come into your inbox, so many, conflicting time constraints and so forth. So if one wanted to be informed as just a voter, what would you recommend?
The ELM has partnered. So, I came here today to talk in our 501c3 capacity, nonprofit, nonpartisan. I will endeavor to stay in that space because I do think that climate should not be a partisan issue. But it is true that some candidates, some incumbents and challengers are far better on these issues than others. ELM Action Fund does do endorsements of candidates at the municipal cycle and state legislature, all the way up to statewide offices like governor and auditor, attorney general. And so that can be a litmus test or a guidepost. We also aggregate the endorsements across all of the environmental organizations that do endorsements. Sierra Club, Clean Water Action, Neighbor to Neighbor, 350.org, all engage in endorsements in some way. And so ELM it aggregates them all in a green voter guide that we publish a couple of months before key elections every year. And so I can drop the link in the chat too, but if you want sort of a handy reference for which competitive races have received endorsements, this is that's a good place to go. Massachusetts is not, for a range of reasons, many seats are not challenged every year. Oftentimes incumbents enjoy being incumbents for a long time without having challengers. So we really do focus on those races where there is a viable challenger, and that's where we're putting our energy to help voters understand their record. We have also in the past done a scorecard for lawmakers and for the executive branch, so that voters and citizens can understand that they can see the votes for their lawmakers across the whole legislative session, and we'll assign grades accordingly. The Massachusetts State House is not known for its transparency, and so it's hard to know sometimes, and we try to help out. So I can drop a couple of those links into the chat.
I think that's a great point. We've been struggling in Massachusetts trying to understand a little bit more about what happens at our state house. So I think the kind of work to understand voting records and compile it is actually very helpful. And, I encourage, as many of us at MGH have done, voting is a healthy act, and knowing who you're voting for is an empowering thing. And we encourage our colleagues and patients to do that regularly. I want to call up Dr. Winnie Armand, who is also very involved with the work of the center and is a primary health physician at MGH Chelsea. And I think Winnie wants to ask a little bit about environmental contamination. And I'll just comment also, Winnie, that I know ELM has been very involved with some of the issues around PFAS contamination and drinking water in Massachusetts. So maybe Winnie, you want to ask your question and we can talk a little bit about that also.
Yes, thank you so much for joining us today and all your advocacy, Elizabeth. As a prescriber, I only recently, I think, started to realize how much impact pharmaceuticals have, not just in terms of greenhouse gas emissions in that scope 3 area, but also just with environmental toxicities. And it's been frustrating because I feel like there's very little regulation, very little transparency, and it's hard to know as a prescriber the impact that each prescription has. So I'm wondering if you know much about, well, if you could tell me more about what ELM is doing, and maybe even on a state level, if there is anything we can do for more transparency before we get to the national level.
It's a good question. ELM was involved in passing the Toxic Use Reduction Act in the 80s, but you're right in saying that transparency and disclosure lag by decades. The laws, takes the threshold for a substance to be listed as toxic or harmful or regulated is so high, and it takes so long to get those regulations in place. It's not an issue that we have had the bandwidth to lead on. We look to partners like Clean Water Action, who has a great advocacy program on toxics, and CLF is a good partner for us on PFAS. I will say, having watched the experience of advocates pushing to ban polybrominated flame retardants at the State House, Massachusetts now has a law to phase out, not all, unfortunately, of the hazardous flame retardants, but many of them in many applications will no longer be allowed. And it was not so much environmental advocates we made the case lustily, but it was really voices of firefighters themselves and healthcare providers, particularly pediatricians, saying, look, there is no benefit to putting this junk in car seats that outweighs the risk to this child. There's no benefit in putting these bioaccumulating toxics in pajamas that outweighs the endocrine disruption and all of the other hazards that this child might anticipate. And so I don't have exactly an answer to the question that you posed, but I will say that your voice as a healthcare provider is incredibly valued and is heard in a way that mine will never be. When you show up in your lab coat and you say, I'm really concerned that I am prescribing poison to my patients, and I really want to, I want to be able to sleep at night, and I need stronger laws to do that. That goes a long way.
Thank
Thank
you.
you, Elizabeth. I'm gonna turn a little bit now and see if we've heard a lot about advocacy on the government side, particularly here on Beacon Hill. I'm curious your thoughts on working outside of government and advocating and partnering with corporate or business entities to achieve some of our goals outside the regulatory regime, and what the role is or what the appetite might be among some of the businesses with which you've worked, whether on the corporate council or outside, where we can, as a nonprofit healthcare institution, clearly with our own mission and goals, to see what the opportunities might be and how we could strategize together, and kind of the really big picture goal that I have in my mind, certainly as I think about how we can, in particular, aim to build a more sustainable supply chain, having this image of nutrition facts on our packaging, except being environmental facts, that this central line kit in the emergency department carries with it 450 grams of carbon dioxide equivalents and 7 grams of nitrogen oxides and so on, so that we can, as a healthcare institution consumer of products, make educated decisions. So I think that I'd love to hear your thoughts on how we can get the business, vendor, manufacturing community to work with us on some of those projects.
It's a great question. I mentioned that I used to work at Adidas, and many apparel and footwear suppliers came together under the umbrella of the Sustainable Apparel Coalition with the goal of building what they called a Higg index. Higg is the smallest particle in physics, and they were looking to be able to collapse the life cycle assessment of a product. In other words, the footprint of all the water and resources and carbon and pollution that's entailed in taking that product cradle to grave, and put like on the tag a 0 to 100 score, so that if you were like at REI and you were trying to decide between Patagonia raincoat and a Columbia raincoat, you could actually look and say, oh gosh, the Patagonia one has a 42 Higg index and the Columbia one has a 61. They both cost $100. I'm going to get the one with a lower Higg score. And I think that what you're getting to is sort of the power of transparency to enable good decision making. And I think it's a beautiful and important piece of the puzzle. One of the things that I think a lot about is the power of your voice in the trade associations and the lobbying entities in which Mass General Brigham is a member. So like what the Massachusetts Hospital Association has an incredible influence on Beacon Hill. How powerful would it be if some of these climate and environmental bills were their priority too? And it wasn't just you alone as a center or as a hospital or as a company, but really, together with all of your colleagues saying, look, we need prescription pricing reform, and we need, some changes to the mass health funding. You know these issues better than I do. And we also need a price on carbon, for example. I mean, like, this should be one of the top 3 asks that you are asking your trade associations to make. And the same is true at the federal level. I'm sure that there's, you have a presence in DC, you invest a lot in those trade associations, and making climate and environmental issues and equity issues part of that agenda, I think should be part of how you think about using your power.
Thank you, Elizabeth. I would also underscore that many of us have been involved with having our professional organizations be voices on this topic. And I think you raise an excellent point that hospital associations are another entity that has particular influence. Well, we've reached 10:30, so I would like to thank you very much for being with us today. And you're welcome to listen in if you'd like to our next section, or not, it depends on your schedule. But I think what we wanted to do next was to pull up a variety of people who are in our leadership team involved with the MGH Center, and have everybody come on to the video screen now. And we wanted to have some discussion about what our hopes and goals for the MGH Center would be. And so I would like to just begin by introducing some of the faces in the room that you haven't seen yet. So you've met Jonathan Slutzman. I would like to introduce Dr. Tina Duhaime, who is was director of pediatric neurosurgery at MGH up until just now, and the Nicholas T. Zervas Distinguished Professor of Neurosurgery at Harvard Medical School. She's been a practicing pediatric neurosurgeon for 3 decades, and her work has really focused in the environmental realm on understanding the relationship between human behavior and neural pathways and the environmental behaviors that we engage in. And I've learned a lot from conversations with you over the years, Tina. Tina is now Associate Director of the MGH Center for the Environment and Health, and she's also Associate Editor of the Journal of Climate Change and Health, which is an exciting avenue for research in this field. You've met Winnie Armand, who is a practicing primary care clinician at MGH Chelsea. Patrice Nicholas from the MGH Institute of Health Professions. I'd like to also introduce Barbara Belanger, who is a certified nurse in the operating room here at MGH since 1993. She has done a tremendous amount of work with the Perioperative Sustainability Committee here and with the MGH Center. She received actually a Clinical Excellence Award for her work on decreasing waste in the operating room, and she is a valued member of our team. So Barbara is here with us. I don't know if we have Ed. Oh, there's Ed. We have Ed Rake as well. So Ed is Director of Materials Management and Facilities at MGH. He has a big job providing operational support to all of the supplies of all of our hospitals. He oversees the supply chains and our relationships with our medical and surgical distributors, and oversees 7.5 million square feet of clinical space. And so in that setting, he has learned and led a lot on our sustainability issues within the hospital. And so this is our team, and we wanted to begin by letting Jonathan give a little bit of an overview of what our goals at the center are. We have a 10-point plan, which Jonathan would like to introduce. And then we'll have a little discussion about some of the work. And I encourage everybody to please comment in the chat or use the Q&A so we can have some exchange. So Jonathan, I'll turn it over to you.
Thank you, Regina. I want to first say that there are some huge thanks that we need to give, that I certainly need to give, to Regina in particular, as well as Patrice, Winnie, and Barbara for working so tirelessly in bringing this symposium to life and leading our educational efforts at the Center for the Environment and Health. So we should all really extend our thanks and our admiration for their efforts, that they haven't gone unnoticed. So thank you very much, Regina, for leading that effort. It's I can't express how much I really appreciate all that. So welcome to the MGH Center for the Environment and Health. We are super excited, as I hope you all are, for having been a part of this symposium this morning. And now I want to share with you really what our mission is. And here we have, and I'm not going to read it to you, so hopefully you can read it yourself if you'd like, the statement that the MGH has made regarding climate change and environmental degradation and our responsibility and roles in mitigating those effects. That really our responsibility is to protect our community's health by reducing our environmental impacts, by disseminating, creating new knowledge, and by serving as an example to healthcare institutions and other industries in how we can provide environmentally responsible care and operations. Our vision, in a nutshell, is to infuse environmental thinking to all activities at the hospital: research, education, clinical care, community health, that every time a decision is made, just as decisions are made about what we think is the best to provide care to our patients, and decisions are made with respect to financial sustainability, we also should be making decisions with environmental sustainability at the table with an equal seat. And that essentially is what we are striving to do. Over the initial 2 years of the center, we aim to complete a number of initiatives in a variety of fields. And I'm just going to very, very quickly run through them. Each one has its own metrics and aims. So number one is, as I mentioned a little bit earlier, to quantify and report MGH's complete environmental footprint across all scopes. Number two, to review and align our policies to include environmental stewardship so that environmental issues are at the table equal to others. Three, to look at options holistically with a life cycle perspective so that we're really comparing risks and benefits in a total picture, the same way as we would with a patient in front of us. Four, to make sure that everybody around us, everybody in our community understands the links between environmental degradation and human health. That's our education mission. Five, to enable everyone who feels comfortable and wants to advocate for a clean environment to protect our communities, whether it's at the local level, the state level, the federal level, or beyond. Six, researching by creating new knowledge and disseminating that new knowledge about the impacts of the environment on human health and how to provide environmentally responsible healthcare. Seven, protecting our people by minimizing chemical use, both clinically and non-clinically. Eight, serving food that really maximizes our health impacts and serving as an example that way. Number nine, minimizing our waste generation and red bag waste contamination so that we're processing our waste in the way it needs and not any more than that. And also minimizing in an upstream way as much as possible how much waste we're generating. And number 10, pretty big, achieving carbon neutrality in scopes 1 and 2 by the end of this calendar year. We are at the beginning of our mission at the center, but I am happy to say that I'm pretty sure we're on track for all of these initiatives as we move forward. So that's all I have to say about those. And I would be happy to continue our conversation.
Maybe I'm just going, thanks, Jonathan. I just thought maybe Tina might like to say a word about the kind of research sphere. And there were some questions in the Q&A about that.
Sure, thanks, Regina. And Jonathan, Jonathan really was instrumental in putting together the 10-point plan and including research in it, along with a lot of input from Regina, Elizabeth Pinsky, many other people. So we've come, I would say, a pretty long way in a fairly short time. And I really also want to say that it's been wonderful to have, the MGH leadership support this effort. So with respect to the research initiative, which is sort of my umbrella here, we think of research in the two ways that Jonathan outlined. First, research on the problem itself, that is health-related impacts of environmental concerns. And our job here at the center is to facilitate that, and also particularly to facilitate research so that it's done in a way from the get-go that could be turned into a publishable product. What we're striving to do here is what MGH strives to do in general, which is to be a leader in, all the fields of health. This one is, a sort of a new one for us to tackle. And many times these particular things are outside of people's regular work related sphere. So we're here to try to help you if you want to do a research project about something that happens in your domain, in your unit, in your physical location, in your practice. And you say, well, what about all those gloves? Where do they go? What's the waste of those? Or what about this anesthetic gas? Is there data out there that other centers have done something to improve their output in this regard? And is that something we could do here at Mass General? We'd like to be able to provide a resource to you to say, how would you set up that question? How would you collect the data? Who do we need to hitch you up with in terms of statistical expertise? And there's a lot of resources that we have just in our people power, just in our network of people here at Mass General and really across MGB and across many organizations. So our job here is to help you who are on this call participate and even initiate research questions that you're interested in. In addition, the other aspect of the research enterprise umbrella is that there's a huge research infrastructure here. And many people have questions about how do they make their research more sustainable, just like how do you make clinical operations more sustainable. There are many resources for this. Healthcare Without Harm has a whole arm that deals with this, and we're here to help you. I've met with Sue Slavenhaupt and talked about, can we have a consultation service through the Center for the Environment and Health that can help researchers do an audit of their own practice and say, can we use a different chemical? Can we throw things away in a different way? Can we use a different anesthetic gas for our, rodent subjects? So there are ways to do this. We're all just learning. I'm just learning. I'm not an expert in this yet, but we're ready and willing to try to help. Finally, the other hat that I wear in this is to help with publication. So as Regina mentioned, I'm the associate editor for this brand new Elsevier journal on climate change and health. And if you're looking for a place to potentially publish this, we can help to see if that would be a good place for you to submit a manuscript, a review article, a commentary, a case report. We've already, just in this series now today, heard several things that might be publishable. So we're here to help you with all of those things. We're here to facilitate your own efforts, to not make it more homework and more work on top of what you already do, but to hopefully integrate these threads in the work that you're already doing. So thank you, Regina. I'll stop there and let somebody else talk about their umbrella.
Thanks, Tina. I think it's really nice to think about some of the bottom-up type of approaches that might result from the center being in place now. I wonder, Winnie, Patrice, and Barbara, if one of you would just say a word about the lecture series that you're working on putting together as well over the coming year.
I'm happy to start with that, and Patrice and Barbara jump on in. This is really exciting that we're putting together a grand round series for the Center of the Environment of Health and the Institute of Health Professionals. They'll be starting next month, actually. The first one will be about heat, the impact of heat on health. They will be the third Wednesday, virtual from 12 to 1, usually 1 or 2 speakers with time for questions and answers. So this will be a partnership again with the Institute of Health Professionals. And Patrice, Barbara, would you guys like to add anything?
Thank you, Winnie. We're delighted to be a partner with the MGH Center for the Environment and Health at the MGH Institute of Health Professions. As I shared, we have a Center for Climate Change, Climate Justice, and Health, and hosted a webinar series this past year. And as a matter of fact, Laura Basu, along with a nurse practitioner colleague, Deidre Alessio, presented in February, and it was wonderful. So this really builds on our early effort to host a webinar series, and we're thrilled to be partners in this. I'll also share that we're delighted to have nursing and patient care services represented so well with the Center for the Environment and Health. Barbara and I are leading the nursing and patient care services efforts with our appointments at Mass General Hospital. I represent the climate and health arm, and Barbara represents the sustainability arm. And Barbara, please offer your thoughts.
Yes, thank you so much, Patrice. I was planning on doing that. The perioperative area has been very concerned with managing waste for a very long time. The ACNO, Patrice Osgood, has been focusing on reducing waste since long before 2017. And our committee was developed in 2017 to look at recycling, improving recycling of waste. And we were very successful until some global changes came about that reduced the ability to recycle. But we didn't give up. And we have been focusing on the past 2 years through COVID to look for ways and to really persevere and push for alternative options to reduce plastic medical waste. And in alignment with what Jonathan was talking about, we are looking at reusing, recycling, and reducing the single-use only plastic. And we've been and composting as well, and using plant-based items. We're looking at all sorts of opportunities to help Mass General and the healthcare system reduce plastic medical waste. It's been very interesting. And we also are including the anesthesia department in our seminar discussions on how to decrease the gas emissions and what efforts are being put in place for there. And they are very influential. And the surgical team, the surgeons are very influential in helping us to reduce waste as well. It's a very collaborative, interdisciplinary approach from the perioperative services.
Barbara, you've been such a leader and thoughtful on this topic for a long time, so we're fortunate to have you involved with this center. And I know that waste reduction and materials is such a big topic for people. And I wonder, Ed, if maybe you'd like to say something about your role also.
Sure.
With
Yeah, I just, you know, it's great that this is coming forward in our conscience and we're starting to kind of do this in our day-to-day. And so when you look at like supply selection, we should be looking at things and saying, you know, is this coming from a vendor who's environmentally responsible, or can we start to select that way? We used to look at, you know, pricing, clinical efficacy, service, and now sustainability and environmental stewardship is part of that discussion. And I think it's great because I've been here for 27 years, and even though it's kind of been in and out of my line of thinking, it's never really been kind of centered where it should be. And I think that this center, along with the plan, is really going to help drive real change. And so, you know, do we have too much PVC and DEHP in our products? Do we have to do a chemical inventory and say, are we using chemicals that meet standards that we're comfortable with? And this is all work that has been sitting there. We know about it, but I really think the plan gives us the roadmap to getting there. And so when you have people like Barbara on your team, you know, she's been, you know, at it and working hard, and this is really going to push other people to do the same. And so you look at something like the blue wrap, Barbara, they just put the baler in to start, you know, recycling that. Vendors didn't want that stuff, and they just stayed with it, and they found the right vendor to do it. And you know, so kudos to her and her team. But I'm just really thrilled that I'm part of this. So thank you, Jonathan, and everyone else who was involved. And it's fun to do some work with our nutrition and food service partners and the things they've been doing to get antibiotics out of our meat, to give us more plant-based options, and to increase awareness around healthy options in the cafeteria. So these are all things that are raising awareness, and I guess it's about time, you know. And maybe for me it was a wake-up call. Maybe everyone else has been, you know, doing more of their part, but for me, I really think now I'm ready to kind of get engaged, and I think we can make some real change with our manufacturers and vendor partners, as well as within our facilities. We've done a great job, I think, in general, being pretty good with energy conservation, but there's new places we can look. We were just going to have Jonathan tour our the back room of our cafeteria to see where, what equipment we're using, and is there better ways to be more energy efficient. So I'm actually really excited about this. I have a lot of different hats, but this is one I will wear proudly.
May I just add one more thing? The director of the perioperative area has been very hands-on and influential in promoting a lot of the pilot studies that we're doing with the plant-based items and any of the alternative options that we've been doing. And it's really great to have that leadership support, which is essential.
Yeah, who would have thought you could have like a needle counter made out of plant-based materials, but they're out there. So and I think more and more options are going to be available to us as we start to look. And one more thing, we're also partnering with our group purchasing organization, so we're part of Green Health. But Vizient, who we also work with, they're also pushing their vendor partners to give us better options on this front. So a lot of great things happening, and it's a bright future, I think.
I think we all feel one of the unique elements of being a hospital-based center that's focused on environment is that we have a lot of opportunity to both take advantage of our purchasing power and our influence, but also to bring immediate attention to the connection between health and these decisions that sometimes we don't think of within our sphere. So it's great, Ed, that you've been such a great partner all along the way, as have many others within the facilities part of our hospital system. So it's a cross sphere collaboration, which is fantastic. Well, I welcome any comments from other people on the panel, but if not, we can turn to Jonathan as our director to kind of close us out.
Thank you very much, Regina. And I'll echo what others have said, that really what's, to me, one of the most exciting aspects of this center is that we are so cross-cutting, that we have leadership including physicians and nurses and non-clinicians who span so many of the departments, both clinical and non-clinical, of our institution, that are just so integral to our operation, to being able to provide the care that we do. And the one statistic that I or kind of anecdote that I quoted to a colleague not too long ago is that if you remove all of the physicians from a hospital, it'll grind to a halt in about a day. If you remove all the nurses from a hospital, it'll grind to a halt in about 8 hours. If you remove all the environmental services personnel from the hospital, it will grind to a halt in about 20 minutes. So that gives you an idea of just how important so many people are to the functioning of our institution, and how many different people there are who can contribute to improving our environmental performance and identifying ways that we can do things better. There is nobody at our institution who cannot be a part of the Center for the Environment and Health, who cannot have ideas, who cannot provide some insight that any one individual person wouldn't necessarily know. And then the last anecdote I'll share is from a former faculty member who's on the faculty at Brigham and Women's Hospital, another one of our MGB institutions, who used to say that if he would give you a test on resuscitation to each one of us, nobody would get 100%. But if he gave that same test to all of us together, we would easily score 100%. So this is an effort where we have to be all together and crossing the silos that have traditionally governed our institution to really make it so much of a better place. I can't imagine being on this journey with a better group of people. I welcome any one of you who's participated with us this morning to reach out to the center if you would like to get involved, or if you have more questions or are unsure what you could do, please get in touch. Our email address is ceh@mgh.harvard.edu. And you can certainly see our website on the MGH website. So with that, I'll say thank you to all of our panelists, to all of our speakers this morning. And again, thank you to the people who enabled this to be organized, Regina, Winnie, Patrice, Barbara. I've enjoyed this morning. I hope you all have too. And with that, I will say thank you and have a great rest of the day.